Hi, my name is Josh Leonard, and I'm an interventional cardiologist at Memorial Hospital, Jasper, Indiana. And I'd like to speak about the vaccine and some of the frequently asked questions I get from my patients, particularly regarding cardiology questions. First of all, I definitely encourage my patients to get vaccinated, and I personally have been vaccinated, my wife, my children, my parents, and so far we've all done very well with the vaccines. Our side effects were minimal. Most of my patients that I see describe getting the vaccine and may have had some mild side effects with either the first or the second vaccine, and typically they've come through the vaccine without any major problems. Matter of fact, I haven't had any patients hospitalized or majorly ill that would require any serious medical intervention from the vaccine. And so the vaccine in my patients, which is a very high-risk group and sick elderly group, have done well with the vaccine. And what I talk to patients about with vaccines in general is that most of them have lived through some major changes in healthcare during their lifetime. And they've seen people affected by polio and all kinds of major diseases that were almost eradicated by vaccines. And so this fear about the new vaccine, I think, is just because it's new, not because of vaccines in general. And yet technology continues to advance, and this technology has been brewing for a while. And I'm not so cynical to think that the Center for Disease Control would bring out a vaccine that would be harmful to the United States of America. I definitely feel like there are a lot of really smart people working on this who have spent months and years working to develop this technology, and we're very lucky in the United States of America that they could bring it out so quickly. And so, as far as the risk of the vaccine, particularly from a cardiac standpoint, I haven't seen any major side effects. Mostly it's been minor, side effects. And yet COVID has definitely affected my patients. And almost every patient I see tells me about their personal COVID infection, their family members, or close friends. And most of them have people they know that have died from the COVID. And so I feel like, this is something that is very concerning, and I feel like it's our patriotic duty in some ways to try to eradicate this so that our country can keep going from an economic standpoint, and also to keep the kids in school and learning. And so all those things require us to work together. And so cardiology-wise, I feel like things have been going well with our patients and the vaccines, and yet definitely we've lost patients due to COVID-19 infections. And the ones who have been vaccinated and then go on and get COVID-19 seem to recover much faster, and if they do end up in the hospital, it's a much milder form of the disease. And actually, I just heard about a patient today who was admitted and was lamenting that he hadn't had the vaccine. So I feel like this is definitely something that is helpful. Is it perfect? Is it completely without side effects? No. But compared to the alternative, it definitely has been the right thing to do. And I would encourage all of the people in our county and surrounding areas to strongly consider getting the vaccine. And please talk to your healthcare providers about getting the vaccine, because a lot of information people are getting is faulty. Even as a healthcare provider, sometimes it's hard to get accurate information, and yet the information that a lot of people are getting is secondhand from friends, from social media, and a lot of it's just completely false. And so most people are basing their decision on emotions or just secondhand information. And so I would encourage you to contact your healthcare provider and speak with them, and weigh your odds of side effects from the vaccine, which are very low, versus real illness and possible death from the infection. So.